Men over 60, let me ask you honestly. Have you ever had to wake up 2 or 3 times a night just to urinate? Have you noticed it's getting harder to pee, the stream is weaker, or sometimes there's even a bit of blood in your urine? Many of us brush this off as just part of getting older, but the harsh truth is, those seemingly harmless signs could be the very beginning of prostate cancer, the silent killer that's quietly taking the lives of hundreds of thousands of men every year. What makes prostate cancer so dangerous is how quietly it creeps in. It doesn't hit you with intense pain right away. It sneaks up, slowly, and by the time you notice, it's often in a late stage, when the cancer has already spread to your bones, causing chronic pain and cutting your survival chances in half. But here's what you also need to know. If caught early, the chance of beating it and living another 10 healthy years is over 90%. The real issue is, how many of us are truly paying attention to our body's early warnings? How many of us ignore the small signs, only to one day receive bad news in a doctor's office? In today's video, I'm going to walk you through the earliest symptoms, the warning signs that men over 60 absolutely must not ignore. And trust me, you might find yourself experiencing one of them right now. So don't look away, because the difference between knowing and not knowing can sometimes be the difference between life and death. You know, I'm a doctor who's spent many years studying and treating men's health issues, and among them, prostate cancer is one of the conditions I've seen the most. I've witnessed both outcomes. Some men came in early, caught it in time, went through simple treatment, and went on to live many more healthy years. But others were too dismissive, and by the time they got checked, the cancer had already spread, and treatment became a painful uphill battle. These experiences are exactly what drive me to share this knowledge with you, especially those of you who are over 60. I don't just want you to live long. I want you to live well, with strength and quality of life alongside your children and grandchildren. In this video, I'm going to show you how to recognize the earliest signs of prostate cancer, signs that may seem harmless but could determine the future of your health. So please, stay with me until the end. And before we continue, I have a small favor to ask. If you find this topic important, give this video a like, and make sure to subscribe to the Senior Vitality Now channel. That way, every week, you'll receive more clear, practical, and useful medical insights. And don't forget to hit the notification bell, so you never miss a single piece of information that could help protect your health in your 60s, 70s, and beyond. 3. Why is prostate cancer dangerous? Brothers, the prostate may sound small, only about the size of a walnut, located just below the bladder, but it plays a critical role in men's health. It produces the fluid that nourishes and protects sperm, contributes to fertility, and also affects urinary function. Normally, most men don't pay it any attention, but after age 50 or 60, it can become a serious weak point. What makes prostate cancer so dangerous is how silently it progresses. In the early stages, there are usually no clear symptoms. You go about your life thinking everything's fine, all while a tumor may be slowly growing. By the time noticeable symptoms appear, such as difficulty urinating, blood in the urine, or bone pain, the disease is often already in a late stage, when treatment becomes much more difficult and far more expensive. What's even more frightening is that, once it's advanced, prostate cancer can spread to the bones, especially the hips and spine. At that point, the patient doesn't just face the risk of death, but also deals with chronic pain, loss of mobility, and a dramatic decline in quality of life. I've had many patients say to me, "Doctor, I just wish I had come in 1 year earlier." On the flip side, if the cancer is detected early, the 10-year survival rate can be over 90%. That means with just one simple routine checkup, you can secure the chance to live another full, healthy decade. And that, my brothers, is exactly why I don't want you to miss the warning signs I'm going to share next. 4. Early warning signs you shouldn't ignore. Brothers, I want you to really pay attention to this part, because this is when your body starts sending its first warning signs. They're usually small, easy to dismiss, but they could be the difference between life and death. The first and most common sign is difficulty urinating, a weak urine stream, or an interrupted flow. Many men think it's normal for older guys to have a weaker stream. But in reality, when the prostate becomes enlarged or a tumor begins pressing on the urethra, the urine stream weakens. You may find yourself needing to push or strain to urinate. Notice a slow stream. or feel like your bladder isn't fully empty. One of my patients, Mr. Johnson, 62, from Texas, thought it was nothing serious, until one night he had acute urinary retention and had to be rushed to the ER. Upon examination, they found a sizable tumor on his prostate. The second sign is frequent nighttime urination. Some guys brush this off as a normal part of aging, but that's not always true. When the prostate grows, it presses on the bladder, sending false signals that make you feel like you need to pee, even if there's not much urine. If you're waking up 2, 3, even 4 times a night to urinate, it's not just affecting your sleep. It might be an early warning. Another red flag is blood in your urine or semen. This is a symptom that must not be ignored. Even a small trace of blood could indicate a problem in the prostate. Unfortunately, many men stay silent out of embarrassment and miss a golden window for early detection. Next, if you're experiencing dull pain in the hips, lower back, or pelvic area, don't just assume it's spinal degeneration or typical old man back pain. Prostate cancer, when it starts to spread to the bones, often causes pain that feels very similar to musculoskeletal issues. I had a patient who spent a year treating what he thought was a degenerative back problem. He took medications, had acupuncture, but nothing worked. Only after a deeper scan did we find out the cancer had already spread to his hip bones. Another symptom that's often overlooked is loss of bladder control, feeling the constant urge to pee, but passing only a small amount, or even leaking before making it to the bathroom. This happens when a tumor disrupts the body's urinary control mechanisms. Finally, there's one sign many men feel too embarrassed to talk about: reduced sexual function and erectile dysfunction. You might feel less energetic than before, lose interest in sex, or have trouble maintaining an erection. Yes, this can be due to aging or hormone changes, but it could also be a sign of a serious prostate issue. Let me emphasize, any one of these symptoms on its own might just be a benign issue. But if they persist, or you're experiencing several of them at once, don't take it lightly. That's the moment to get checked immediately. Because one visit to the doctor could give you peace of mind for a whole year, but ignoring it could cost you an entire decade of good health. 5. The difference between benign enlargement and cancer. Brothers, this is where many people get confused. I've met countless patients who came into the clinic in a state of panic just because they were having trouble urinating or waking up multiple times a night to pee. But on the flip side, there are also those who are far too dismissive, assuming these are just normal signs of aging. The truth is, benign prostatic hyperplasia, BPH, and prostate cancer can have very similar symptoms in the early stages, but their nature is completely different. With BPH, the prostate simply grows larger with age. It presses against the bladder and urethra, causing difficulty urinating, intermittent flow, or frequent nighttime trips to the bathroom. But here's the key. BPH doesn't spread to other organs, it doesn't metastasize, and it's not life-threatening. Treatment usually involves medication, lifestyle adjustments, or in some cases, minor procedures to relieve the pressure. Prostate cancer, on the other hand, may begin with identical symptoms, but it has the potential to become aggressive. As cancer cells multiply, they can invade surrounding tissues and even spread to the bones, causing chronic pain and debilitating fatigue. One key difference is that cancer often comes with additional warning signs, such as blood in the urine or semen, pain in the hips or lower back, unexplained weight loss, or persistent fatigue. I remember a patient in Texas named Mr. Johnson, 72 years old. He came to see me because he was urinating frequently at night and had a weak stream. At first, he assumed it was just BPH. After all, a few of his friends around the same age had similar issues. But when we ran the tests, his PSA levels were elevated, and during the digital rectal exam, I felt an abnormal mass. A biopsy confirmed it was stage 2 prostate cancer. Thankfully, it was still early. He received timely treatment, and now, for years later, he's healthy and still driving his wife to the grocery store every week. Mr. Johnson's story shows that you can't rely on symptoms alone to tell the difference between BPH and cancer. Only a proper medical exam can make that distinction. And that's exactly why I always stress, don't make assumptions, don't self-diagnose. Let the doctor and the tests do that job for you. 6. When should you get checked? So the next practical question is, when should you get your prostate checked? The general rule is this: all men over the age of 50 should have a prostate exam at least once a year. And if you're over 60, regular prostate screening is absolutely essential because the risk increases with age. That's the baseline recommendation for everyone. However, there are certain groups who need to be especially vigilant. If your father, brother, or son has had prostate cancer, your risk is 2 to 3 times higher than average. African American men also have significantly higher rates of both diagnosis and death from this disease, so they should begin screening earlier, often starting around age 45. In addition, men who are obese, physically inactive, or eat a diet high in red meat and saturated fats should also consider getting screened sooner. Let me share a real story. Mr. David, 66 years old from Florida, didn't have any major symptoms, just occasional difficulty urinating. But because his older brother had died from prostate cancer, he decided to get checked early. His PSA levels came back abnormal, and a biopsy revealed stage I prostate cancer. The great news is that because it was caught early, treatment was mild and minimally invasive. Today, he's still healthy and spends his weekends fishing with friends. I want you to remember this. Prostate cancer doesn't wait for anyone. If you wait until obvious symptoms show up, it might already be too late. The only way to be sure is through regular screening. A single exam takes just a few minutes, but it can give you peace of mind for an entire year and even save your life. Don't let fear or complacency steal this vital opportunity from you. 7. Practical advice for prevention. Dear brothers, we cannot change our age or genetics, but one thing is certain. Our lifestyle directly impacts prostate health. I've seen many patients of the same age and similar health backgrounds, yet with vastly different outcomes, simply because of how they cared for themselves. Some enter their 70s and 75s still in great shape, playing golf, fishing, enjoying old age. Others, at the same age, find themselves in a wheelchair due to metastatic prostate cancer. The difference lies in who knew how to prevent early and who did not. The most important thing, never to be forgotten, is regular checkups. After age 60, at least once a year, you should have a PSA blood test and a digital rectal exam, DRE. Many men avoid the DRE, but the reality is it only takes a few seconds, feels a bit uncomfortable, but is completely painless. I remember a patient in Florida named David, 66 years old. He didn't have serious symptoms, just slight difficulty peeing. But because a family member had prostate cancer, he decided to get checked. His PSA was abnormal, and a biopsy confirmed stage I prostate cancer. Thanks to early detection, he only needed simple surgery and is now living healthily, going fishing with friends every week. That's a clear example. Routine checkups can save lives. Alongside screening, a healthy diet is foundational. You should increase your intake of green vegetables and antioxidant-rich fruits, especially ripe tomatoes, a great source of lycopene that helps protect the prostate. Cruciferous vegetables like broccoli, Brussels sprouts, and cauliflower contain sulforaphane, which studies show has anti-cancer properties. Also, eat plenty of omega-3 rich fish such as salmon, mackerel, and sardines, instead of too much red or processed meat. I've seen many American patients who switched from steak and hamburgers to fish and vegetables and saw their PSA levels stabilize significantly. Soy products and nuts, especially pumpkin seeds rich in zinc, are also very good choices. Conversely, limit fast food, fried foods, and sugary sodas. Another critical factor is physical activity. You don't need intense training. Just a brisk 30-minute walk each day, or yoga or swimming, is enough to provide significant benefits. Physical activity improves blood circulation, reduces inflammation, balances hormones, and, importantly, helps maintain a healthy weight, a key factor in reducing cancer risk. I have a patient in New York, Mr. Thomas, age 67. Initially, he was overweight and sedentary. After his doctor's advice, he began walking each morning and gradually increased to 40 minutes. After 18 months, he lost 12 kilograms, his blood pressure stabilized, and his PSA also improved noticeably. Additionally, attention to sleep and stress is essential. Sleeping 7 to 8 hours per night and reducing stress through light activities like meditation, breathing exercises, or playing music helps hormone balance and boosts immunity. Another one of my patients, Mr. Michael, 65, in Texas, had long-term insomnia and frequent stress. After improving his sleep, his PSA decreased to a safer level. Finally, Quit smoking and limit alcohol. These are two major risk factors many often overlook. Smoking increases the risk of death from prostate cancer, while heavy drinking disrupts hormones and causes chronic inflammation. If you quit smoking and reduce alcohol, the benefits become noticeable within just a few months. In summary, to prevent prostate cancer, you need three main pillars: regular checkups, proper nutrition, and consistent physical activity. On top of that, ensure adequate sleep, manage stress, and avoid tobacco and alcohol. It may sound like a lot, but these are actually small, easy actions you can take every day. What's important is to start now, before it's too late. If you do these things, not only will you reduce your risk of prostate cancer, but you'll also improve your overall health, better heart function, clearer mind, and most importantly, enjoy many more healthy years with your family. Brothers, throughout this entire journey, there's one crucial thing I want you to remember. Prostate cancer is not a death sentence if we catch it early, but it can become a silent killer if we ignore the warning signs. A weak urine stream, waking up several times at night, or even a tiny trace of blood in your urine. These can all be signals. Ignoring them, brushing them off, or telling ourselves it's just part of aging could mean missing a golden opportunity for treatment. On the other hand, just one regular checkup, one small lifestyle change, could give you 10 more healthy years with your children and grandchildren. So if you're over 60 and you recognize any of the symptoms I've mentioned, don't wait another day. Go get checked. That's the smartest, bravest way to protect yourself and your family. And if you found this video helpful, leave me a like. It's a simple way to let me know that this information truly matters to you. Don't forget to subscribe to the Senior Vitality Now channel and turn on the notification bell. Every week, I'll be bringing you more clear, practical medical knowledge to help us stay healthy, confident, and fully alive after 60. Please share this video with your friends and loved ones, because who knows, one click today might save another man's life.